Welcome to Through the Trauma podcast. My name is Amber Larkins, published photographer, storytelling expert, visual artist, entrepreneur, speaker, and coach. This podcast was born from one question: how do I get inspiring stories of triumph out to the people who need to hear them the most? Come with me, enter my world, where lives are getting changed, heroes are getting developed, and greatness is being achieved. Hello, it's Amber with Through the Trauma podcast, and today I have with me Agam Dhawan. He is a psychiatrist, and he is going to go into depth with us today about the effects of trauma, how to heal from trauma. He does way more than I can even put into words here. So, Agam, thank you so much for being here with us today.
Perfect. Thank you for having me, Amber.
So I know you went into a little bit of your bio, but why don't you tell my listeners what it is that you do exactly?
Yeah, no, absolutely. So when I was going to medical school, I was trying to decide what type of specialty I wanted. And what really stood out to me was that I had patients before that I was treating, especially in medical school, who had traumatic experiences happen to them before. And so they were responding to that. They were having flashbacks. They were having these nightmares. But then I saw how, like, over the course of, let's say, like 3 to 6 months, how they were able to be treated and get better. And that really resonated with me, because like people were able to improve from their current situation to where they are now and actually benefit their quality of life. So I decided to go into psychiatry. And so when I was in my residency, started learning all about, okay, this is what trauma looks like. Okay, these are the signs of trauma. This is what happens acutely after a trauma. Okay, this is how to treat it. This is how we can use different modalities to address the issue that's happening.
So you started to see an issue with trauma, and this has kind of led you into what you're passionate about, which is helping people overcome trauma.
The biggest thing that I remember when I was in my first year of residency, we were inpatient in the inpatient hospital. So that's where people get admitted if they're feeling suicidal or they're hallucinating, that type of thing. And I remember there was this one girl that I saw, and she was having like significant depression, and like was having these suicidal thoughts, and people were wondering, like, what's going on? Why is this? She was doing really well in school. She had a good family life. Like, money wasn't really a problem. So I was like, why is this happening? Turns out that a couple of years ago, she'd been sexually abused by a family friend and never told anybody, because she was afraid that it would mess up the family relationship. So she kind of sat on this, and then, like, from age like 13 to 16, things kind of got worse and worse and worse, until she found it really hard to deal with a lot of these memories that she was having, getting triggered, especially because, like, she was still seeing that family friend. And so like, they would visit the home, and so of course through all this, like, CPS was called. The parents were made known, right? The family was that other person was removed from, like, the vicinity, and it just kind of like opened up that can of worms. But then through that experience, I also started seeing adults as well, and saw adults who had not shared traumas, had not shared things that had happened, or had bad things like that happen to them. And I started realizing that, how come so many people with mental illnesses, like, if you ask them about trauma, like, there's always something.
Mhm.
Like, there's always something. And like, that really stuck with me even till now.
Mhm. Did you experience trauma in your own life that kind of led you into being passionate about this topic?
That's a good question. So when I was younger, I was 16, 17, I had this routine every day where I would come home every day after high school, and all I wanted to do was play video games. Like, that was my routine. Just go downstairs to the basement, shut off the lights, and play games. And so from that, what ended up happening was, I didn't go out socialize. I never really interact with people. I never had too many friends because of this. There was a girl I wanted to ask out to prom, but I was too scared, so she ended up going out with somebody else. And like I remember all these things, and I remember like the feelings of like loneliness and um not feeling worthy, like not feeling enough, like why aren't I chosen, that kind of thing. So I'm feel grateful to say that I don't have any like explicit trauma where I was sexually abused or physically abused. Like I grew up in a loving household. I'm very grateful for that. But I do remember feeling this like lack, this inadequacy growing up, and it's still something that I think about to this day.
Mhm. Do you think that all people experience that type of, like, do you think that is part of the human experience?
Yeah, of course, of course. We all have issues and things that happen, right? And so something that I tell a lot of patients is what happened to you is not your fault. What happened to you is not your fault. However, it is your responsibility.
Mhm.
So we all have like, if you have the concept of trauma, right? It's on a spectrum. And how one incident affects a person affects how it is different than how the same incident might affect a different person. Like the New Orleans like hurricane, for example. I'm sure or a car accident. I'm sure plenty of people get in those situations, but yet some experience the effects of PTSD and like the nightmares, like the flashbacks, and like the getting triggered, whereas other people don't. So like that's a huge difference, and so the same event happened, but different people perceive it in different ways. So
Mhm.
trauma ultimately, for the average person, comes down to what events happen in your life and how you perceive it and how it's affected you.
Mhm. Yeah, and that was my next question because this comes up a lot here on as a topic here, and I from talking to different people and interviewing different people, I have come to learn that everybody experiences trauma differently, and you could have the exact same thing happen to 2 or 3 different people, and it all comes out differently.
Yeah.
Um, so in your experience, like, so do you work with people that are specifically like they've dealt with trauma, or do you deal with other types of patients as well?
Yeah, for sure. It's usually a mix. The way that trauma tends to present itself is it's often not like the main thing, but rather it's like a side thing that is coloring why they're here. Like I'll give you an example, right? I had this 23-year-old guy that I was seeing, and so he was coming to me. He was saying that he had some depression symptoms. He's feeling anxious a lot about things, and so that's why he came. And so I'm talking with this, and he said that he had tried some treatments before that didn't really work. And so I'm talking to him before. He's saying that yeah, he loses his cool a lot. He gets really upset easily by things. Falling asleep is kind of an issue. And so we start honing in on this, and he says it's a lot of it centered around his girlfriend, his fiance. And so now, like falling asleep next to her was especially difficult. Um, when he got upset, it was often at things that she had done and said, and we start delving into it. And he says that oftentimes, like he felt like he got triggered by no reason in this relationship. Ask him about his past relationships. And so it turns out that when he was in high school, he was dating this girl when maybe like 14, 15-ish. And he says that this girl was trapping him in the relationship when he didn't want to be there. And like she would show up to his house a lot and she would threaten things like, I'm suicidal. I'm gonna hurt myself if you leave. I'm gonna do this. She also threatened to make a police claim that he was abusing her, that he had um, that he had assaulted her, so that way he would stay with her. And he cites that feeling of like psychological trappedness in that relationship. And that relationship ended when they both graduated high school, and she had gone off somewhere else, and then he went off somewhere else. So, like in that case, right, like he didn't present initially for depression, anxiety, or he didn't present initially for trauma, but like And it's not like a traditional trauma, like, oh, you had a war incident happen or you had sexual abuse happen, but it was still psychologically distressing enough to him to the point that it caused long-lasting issues.
Hmm. Do you think that people who have these types of traumas that are like you described it as non-traditional type of trauma, I would say it's trauma that is like not necessarily recognized as trauma. Like when we think the word trauma, we think it's somebody with PTSD that has come out of a war, or somebody that has experienced robbing at gunpoint, or, we think of these very traumatic situations. But do you think that the people who've experienced trauma, but yet it's not the it's like the non-traditional types of trauma, do you think that they almost suffer worse because it's not widely accepted as trauma? Does that
Mhm.
make sense?
That makes perfect sense, yeah. So there's a subtype of uh, PTSD. It's called CPTSD, meaning chronic PTSD. And this, unfortunately, is not part of the official like DSM manual just yet, which is basically like how psychiatrists and other mental health staff um, apply diagnoses to people's symptoms.
Mhm.
But it is like understood in the field that chronic trauma is a thing, right? So, for example, if somebody grows up in an abusive home, let's say they witness domestic abuse, or they are being domestically abused, or they're chronically sexually abused, even just like when I was mentioning witnessing, like that can be a form of trauma where, let's say, from age 5 to 10, you witness your mom and dad fighting a lot and physically fighting, and there's alcohol and there's violence involved. And so now when you're 20s and your 30s, you're trying to have your own relationships, you find it really hard to pair bond with people because you can't trust them. You might feel subconsciously like fighting in relationships is normal, right? You might have difficulty time sleeping when you're with a partner, for example, because you don't know how it might erupt. And these are like subconscious things that people don't even realize are connected until you start really delving deep into it. So to answer your question, yeah, it definitely can have an impact because it's much more insidious and like longer lasting rather than like a quick sudden event that people notice.
Mhm. I can see that. I can definitely see how that can be. And I talk to people with all different stages and types of trauma, and you know, it's like we hear these stories that's like eyebrow raising, like, oh my god, I can't believe that you've experienced that. But then you hear stories of like it's just kind of a more milder type of trauma, but it is more of a consistent type of trauma. And I first learned about this when I was learning about like abuse in the home from like spousal couples that like one of the very not the first, but like one of the first episodes that I did, I had interviewed several women who had undergone like narcissistic abuse. And this was the first time I had really read about this, where there's like this persistent abuse in the sense that now you're doubting everything that you're doing. Um, and it plays a huge, like, sometimes undoing what has been done mentally in a relationship like that can be it, it's really hard to change the mindset, because for so many years that mindset has been twisted. Have you ever dealt with anybody with like narcissistic abuse?
That's a really good question. So when you say narcissistic abuse, are you referring to like a relationship where someone's put down a lot or like is verbally attacked a lot? Like what are you referring to exactly?
Mhm. So, if I've done a lot of studying on narcissistic tendencies. I think every human has some level of narcissistic tendencies. Like
Of course.
it's human nature. But I also think that some people, this kind of manifests in them a little bit more. And it's really hard for me to understand, I'll be honest with you. But I do believe there's certain characteristics that would define a relationship, and whether that be a romantic relationship, a spousal relationship, or a child parent relationship, or even a
Mm-hmm.
friendship. But there's high levels of like manipulation. There's high levels of gaslighting. I don't know if you're familiar with that term,
Mm-hmm.
where, people, they make you think like you didn't say this. This is how I remember the situation. Oh no, you remember that situation wrong. That's not how it happened. I would say manipulation is probably one of the biggest things that I see. It's almost like a brainwashing, if it makes sense. Like where you, for so many years, you either are raised in that situation, or you've been exposed to that situation in a relationship, a romantic relationship, to the point that now you doubt yourself. Like, did I really say that? I don't. Now
Mm-hmm.
I'm confused because they said I did. I don't remember saying that. Like, then you start to doubt yourself. So I was curious if you've ever had patients that have dealt with that, or what is your take on that?
Yeah. So
Because the reason I ask this too is because narcissistic, like, it's so hard to put your finger on. And this is what brought this to mind as we're talking, because with certain types of trauma, it's so hard to put your finger on why you're being triggered, what's really happening. Like, as someone who's being triggered, you don't even know.
mm-hmm.
So it's very inconspicuous, I would say.
Yeah. I'll share a story with you. So when I was in my first year of residency, I was like 26 at the time. We were working the inpatient unit, and we had this one guy come in. And so imagine like mid 40s, like trucker kind of dude, and you think he's like very masculine kind of looking or whatever. He'd come in because he'd slashed both of his wrists, and so he's in the psychiatric hospital getting treatment. And so I go and talk to his girlfriend, and the girlfriend shows me photos of what had happened, because he'd slashed his wrist in the truck, obviously, like inside the truck. And so this truck is packed with blood, like completely. Like there's like I still remember, like there's blood on the dashboard, there's blood on the steering wheel. It's like dripping down from uh like the dash, right? Like you see it all, and it's like everywhere in this car. And so I'm asking like what happened? And so the girlfriend goes, so we were arguing, and after this argument, he said that I'm gonna go kill myself. And so she said like what, like stop, you can't keep saying that, because he had a habit of actually saying that a lot. She says that he would also hit her too. And he would hit her, and he would say things like at other times during the argument or during like their relationship, but then he would flip to the opposite and say, I'm gonna kill myself. And so at that time, that's when he went to his car and slashed both of his wrists. And I remember talking to her, and she said this, not me. She goes, I know you're probably thinking, why am I still with him? And like I didn't ask her that, but I said, okay, yeah, so like why are you still with him? And she goes, because I love him. Even from like kind of viewing the situation from the outside, right? Like the obvious answer is like, okay, don't be with this guy, right? That's the obvious answer. But in her situation, all the emotions that are plagued in, all the highs of the relationship, I'm sure she's felt contrasted with all the lows, right? It probably has kept her in some kind of, you call it like Stockholm syndrome, call it trauma bond, like whatever terminology you want to use. She felt this connection towards this guy, and now seeing him at his low, now she feels like she wants to help him.
Mhm.
So it really is like it's crazy how tightly gripped it can hold you.
Well, and on top of that, human nature, like, we get into this survival mode. And I think that sometimes when people, and I'm definitely not an expert on this, so I'd love your feedback on this, but I think sometimes when you get in that survival mode, it becomes like a fight or flight type thing. So it's where you are in this place of like survival. You're not thinking about the abuse that's happening. You're not thinking about the things that what's the trauma that's being developed inside of you. You're just really trying to like navigate that situation. So
Mm-hmm.
what happens then, I believe, is that years later, when you look back and you're like, oh my God, like this was a long process of manipulation or abuse, mental abuse, there's then it's having to undo all the things that was done in that situation. What are your thoughts on that?
Yeah. So I think what you're kind of talking about is the uncoupling process, right? And so, for example, in this case that I was sharing, she wants to keep going back to this person. And oftentimes what that stems from is how the relationships that we perceive earlier on tend to be what we seek out because that's what's comfortable, that's what's familiar, that's what we view as love. So it's very likely that in this lady's past and maybe in her childhood, maybe her mom and dad were like this. Maybe she witnessed some kind of behavior like this in her brother. Maybe like the mom had a stepmom, the dad had a uh mom had a stepdad, dad had a stepmom, right? Like or witnessed that kind of behavior. And so like that's what becomes comforting to them. They can create what we call like different attachment styles, right? Rather than like a secure attachment where you don't feel like you need to push or pull away from someone based on how you're feeling, but you can kind of meet them in the moment, right? And go on.
Well, I was just going to ask, so how do you point this out to someone like that's in the middle of this? Like you take this girl, the situation that you described. How do you point this out that this is a toxic situation and needs
It's
to be
very hard.
addressed? Yeah.
It's like the saying like you can lead a horse to water, but you can't make it drink, right? Every cigarette smoker knows that smoking is bad for them. Every alcoholic at the bar knows that it's bad for them, yet they keep doing it. And oftentimes it isn't till like they hit some sort of rock bottom that they are able to kind of step back and assess themselves and then decide how they want to proceed. And like I'll give you another example. So I had when I was in med school, I had this 60-year-old guy, and he'd had 3 heart attacks, and so he was in the hospital for his third heart attack. And so while he's in the hospital, I was chatting with him, and they were talking about smoking and stuff, and he's like, "Yeah, I've been smoking for X amount of years. Like, there's no point quitting now, right?" And like he just was not ready to do that. He had 3 heart attacks, and I remember just like I was just chatting with him, and I remember asking him, so like I was asking about his family, and he says, "Yeah, I have a granddaughter, and she's gonna get married in 6 months." And I asked him, "Are you going to the wedding?" And he says, "Yeah, of course I'm going to the wedding." And so I asked him, like, "Do you think you'll make the wedding?" And he just like steps back or like sits back. He's in the hospital bed, kind of sits back, looks down, looks up, and then like he looks at me and he goes, "I don't know." See him a week later. He comes back to follow up in the clinic, and we chat to him, and he goes, "Doc, like I quit smoking when I got out of the hospital. Quit the very next day." So he didn't do it after 2 heart attacks. He wasn't going to do it after the third heart attack. It was until he stopped back and like assessed his decisions and then made a conscious decision to not repeat that behavior that he decided to change. So similarly with any kind of traumatic event, right? It's not your fault, but it's your responsibility. Like what's done is done. But now you have to decide, that person who's going through it is decide, okay, the behaviors that I exhibit, the mindsets that I have, do I want to continue these? Do I want to keep repeating the same patterns? Or do I now want to be aware of my patterns so that way I can make a different decision in the future?
Mm-hmm. And do you believe that people, like you said, this thing that was triggering to him in a good way? It's like, hey, it woke him up. It was like reality. I may not be here if I don't clean up my behavior.
Yeah.
So it's finding, do you believe it's finding those things in people that you can, like, because different things speak differently to different people, right? I
Of
mean, if
course. Yeah.
someone starts to tell me, like, hey, that's bad for your health, I may or may not change. When they say, hey,
Of
it's,
course.
your
Of
kids, I'm
course.
like, oh, hold on, I better change.
Exactly. Exactly.
So, how does one find, let's just assume, hypothetically, you have a patient or someone or a listener here, listen to this podcast, and they're like, I know that I have some toxicity, some different things, whether that be relationship or habits or whatever, that
Mm-hmm.
is affecting my life, but I just can't stop. Is there advice you would give to those people?
Yeah. So imagine you're at point A, you want to get to point B. But what's happening right now is that as you're driving, you're taking a little detour here, and then you take a side road here, and then you go all the way out here, and then now you're actually in a different city, but your point B was all the way here. So like you lost sight of your track, your purpose, like where you were trying to go on this trip. Just like that guy, right? He stepped back and he reevaluated, okay, well, like what is my point B? My point B is that I want to spend time with my family. I want to be there for my family. I want to be there for my granddaughter. Similarly, in whatever, if you're listening to this, what is your point B? Like, where is it that you want to go? Like, where do you want to lead your life? Like, what kind of life do you want to live? And so once you have clarity on that, like that's the first thing, because I think most people are just kind of driving blindly without knowing where they want to go. And so imagine that the trauma is like you have blinders on or you have like a fog on your windshield. So it's only by knowing first off where we want to go, and then second, clearing off that fog on our windshield, that we can start to correct for that. So like that's the advice I would give, is first like understand what it is that you want and what motivates you. If it's like we're talking about kids, right? You don't want to do something for your health, but do you want to be a good mother for your children? Of course. Do you want them to model healthy behaviors, or would you rather them to model toxic behavior? Healthy behavior, of course. Do you want to see your children in a loving relationship? Yes. So what kind of relationship will you model for them? Right. And so then as you start asking yourself these questions, you get clarity on your answers and your direction.
Mm-hmm.
And then you kind of know what the appropriate steps you need to take to get there.
Mm-hmm. Yeah, I totally agree with you. I think that is great advice. And the only thing that I think of that I just would want to add to that is just, and this is my own experience in my own life, is that as I see these things that I want changed,
Mm-hmm.
you have to keep that so close to your mind, like that purpose, because I feel like sometimes as humans, we're almost like swimming upstream. Is like we
Yeah.
could set an intent that, like, this is my purpose and this is my intention and this is where I'm going. And then tomorrow you forget. It's like, where did that go?
Mm-hmm.
Um, so I know, like, the things that I've really had to like force in my life, like really had to like use a lot of that masculine energy to like make that thing happen. I have to keep that thing forefront of my in my mind. And I had a mentor tell me, um I was asking for some advice and he said, I think the best advice to give you is to that you keep your why in the forefront of your mind. And it really stuck with me because I was like, that's so true. If it's so easily forgotten. I don't know. It's like
Mm-hmm.
human nature. Like we so easily forget things. Um, so I think, and that kind of gets you through the hump, especially if you're trying to overcome something that, like you said earlier, seems very natural. If you've been raised in a home where you're seeing certain things, that's what you know. That feels comfortable. So how do we
Mm-hmm.
make that not feel comfortable is by forcing those pathways in our brain. Have you done a lot of study with the brain and actually how that functions? I'm sure you have.
I was gonna make a comment on what you were saying before.
Mhm.
So, and I think this will help anyone listening to this to really kind of grasp that, right? So we're talking about like you're at point A, we're trying to get to point B. But point A to point B, it's not a straight line. There's lots of turns. And you have a GPS that doesn't speak. So you have to check that GPS every turn you make to make sure that you're going in the right direction. If you don't check it, then you might be way off course and it hasn't spoken to you, so you don't know because you didn't check. Keeping your why in the forefront is like checking your GPS every turn you make to make sure you're going in the right direction.
I love that. I love it. I love analogies that make sense. That one totally makes sense.
Yeah.
It's so true. I'm very intrigued by the brain, like how the brain functions, how it works. Human beings are amazing, and our brain is amazing that we can
Mm-hmm.
undergo some type of grief or trauma and be able to put that in the back of our minds until we're at a place where we can cope with it and then pull that back out. Like, because I think sometimes if we experienced everything as it actually happened, we couldn't we couldn't handle it. So our brain is like that protection mechanism. But as you've worked with different patients, you've seen this on multiple, like I see it on a very surface level. I'm sure you see it on a much deeper level. But can you speak to that kind of like what is happening in our brains in the midst of trauma?
Yeah, that's an excellent question. So you know how if I tell you a grocery list tomorrow, or I tell you to remember this thing, you don't really remember it. If I say get this grocery list done now, or else your child is gonna starve, you'll remember every damn thing on that grocery list. What's happening there is that we're integrating emotion into it. And we know in the brain that emotion pathways, the emotion circuitry, and the memory circuitry are very linked. So any kind of knowledge that you experience with emotion makes it a much more hardcore, like encoded memory in your brain. So when you're in a traumatic situation, you experience intense fear, intense anxiety, intense like distress. So the intensity of that emotion makes that experience like really stick. And so that's why people have like the nightmares and the flashbacks. It's because of how intensely that memory stuck with them, because of how strong their emotions were.
Mhm. And then when they experience this over and over, like I've read this, how then it even further solidifies that in their mind and in their heart.
Exactly. Just like you study something 10 times versus just once, repetition hard codes encodes the memory into long term.
Well, and it's going back to the positive uh, side of that, which is keeping that why in the forefront of your mind. The more that you look at it, I used to think that this stuff was like woo woo a little bit, like
Hmm.
the whole thing of um, affirmations and the whole thing of like, I didn't believe in that when I was younger. I didn't believe in affirmations. I didn't believe in the ability of like writing things down. I didn't understand any of those things. And it wasn't until, I don't know, I was in my 30s probably when I really started to like look into this and see truth in it. Well, I had a personal trainer. This is funny. When I was in my 20s, I had moved from Tennessee out to California. I worked with this trainer, and this guy really shifted my mindset. I mean, he was a fitness guy, but I learned a lot of life lessons from working with him. And one was, he was the first trainer that ever said, like, he had me make a collage of like, which was like a vision board, but it was a fitness vision board of like the physique that I wanted. Cause I used to do fitness competitions. So I had to put all these competitors on my board. I would look at it every day when I would go get food because I was on a competitor's diet. And then there was another thing he had me do, which was he made me write down all of my measurements. So he took measurements of uh, every muscle, like, my arms, my legs, my waist. And I had to memorize those. He made me memorize them. And I'm like, this is ridiculous. Like, why is he doing this? It doesn't make any sense. And so I was resistant and I didn't do it. And this guy was like super hardcore. So we'd be in the gym and he'd be like, what's the measurements around your biceps? And I didn't know it. And he would get so angry at me. But because of that, it forced me to learn it. So I memorized them. That year, I hit every single goal, from muscle growth to diet, like everything. I hit every single goal. And that was the first time that I was ever like kind of awakened to this idea of like, well, what we say matters. What we look at matters. That reinforcement matters. And now fast forward, 20 plus years, I look at things now and I'm like, it does work like that in trauma too. Just that constant reiteration of changing those, I guess, the neural pathways. I'm not going to pretend like I'm a doctor or scientist because I'm far from it, but reshaping the way our brain thinks and perceives things. And it's funny how it works in all areas of life, whether it be fitness or business goals or trauma, overcoming trauma or toxicity. It's fascinating to me.
When we study medications, like let's say we're trying to test out, a drug company makes a new medication and they are wanting to assess whether it's a effective medication. Every medication gets compared to placebo. And the drug company has to show that the medication is better than placebo. So that way it's a legit medication. Otherwise, there's no point. So, for example, with psychiatric medications, let's say we have antidepressant A, and it shows that it causes 33% improvement in symptoms. The placebo might cause like 20% improvement in symptoms. It's a sugar pill. And it causes over half the improvement compared to the antidepressant. So just because the person believed that this pill was going to help them get better, they perceive themselves as being better.
Yeah.
So
it's crazy when it's so crazy. And now I tell my kids this too. I'm like, I read this somewhere about how words they're spelled. So the spelling of words is like casting a spell. They're like, I don't know. I thought it was cool. It definitely reminds me of our words have so much power. And I truly believe that our words have power. Like, I'm a Christian. I believe that the Bible says God spoke and it existed. So it's like, if you believe that and you believe that we are created in God's image, like, then why not our words also have power? Like, our words also. So to me, it's like a common law of the universe, no matter what you believe. I think it's just scientific that it's like our words carry energy and power. And so you have to be so careful, because taking this all the way back to trauma is like people that experience a trauma and then they continue to like wallow in that, like they consume themselves in it. So they're thinking about it all the time. They're, it's going, and they're speaking about it. That's one of the things like I had to get
Yeah.
over when I went through a divorce, and a divorce is traumatic. And that was one of the things like I had to quit talking about it. And I'm like, the more that I talk about this, the more it's like creating bitterness and resentment and hate and all these things. And I don't want to be that person. So I'm not going to. I'm going to
Hmm.
refuse to. But it's, again, it goes back to just, that goes back to really being disciplined and saying, I'm not going to engage in reinforcing this, whatever the thing is. And, whether it be whatever type of trauma that somebody's been through, like I'm not going to continue to reinforce this in my mind. And there's power in that. And I think this also is why there's so much power in speaking things before they exist. So, like with affirmations, which I think is beautiful, like, I am rich. Well, you know, maybe you are rich, maybe you're not rich, but to say that again and again and again, it's like, even if you've not fully believed that yet, and even if you never fully get rich in like what normal people would think, you start to see how you're rich in so many areas of life. Like I'm
Hmm.
rich in relationships. I'm rich in, you know, value in myself. I'm rich, all these different things. So it's crazy how our words truly have power, and that it has the power to shift our perception. It's
Hmm.
really a beautiful thing. So tell me a little bit, because I know I'm talking a lot, but I really want to hear from you. So tell me, like, with your treatment options, what are your thoughts about that? Do you treat people differently, like depending on what their trauma is, or do you go into different modalities, or do you help people by speaking, by drugs? Is it a combination? Like, how does this work in your practice?
That's a really good question. So imagine that you have a wheel, right? And this wheel, you're in the center of the wheel, and there's spokes, and there's all these different spokes on the wheel. And then, of course, at the edge of the wheel, you have the tire, the rubber. So for the wheel to turn properly, all the spokes have to be aligned. If some of the spokes are shorter than the others, if some of them are bent or broken, that wheel isn't going to turn fully. So just like if we're trying to treat a traumatic experience, like you're trying to heal yourself, we have all these different spokes. You might have medication, you might have talk therapy, you have meditation, you have like nervous system training, you have what's called EMDR, you have healthy diet, healthy sleep, you have good relationships, you have process groups, trusting, you have spirituality, connecting with like a higher purpose. These are all spokes into like the wheel of wellness. And so all trauma did was it hit some of that wheel. It hit some of those spokes, and now they're bent, they're out of shape. And so now it's our job to try to correct all those spokes of the wheel again. So medications is one way that I've used to help treat people, right? It can help with some of the anxiety, some of like the impulsivity, like the mood lability, right? Um, getting with other people, other trauma survivors, having a process group where they don't feel alone. They feel like we did this a lot with vets in the VA when I worked there. It was like a lot of the vets would get together. And so if you imagine like 40, 56-year-old men, guys who never talk to each other, suddenly now they're in a group full of brothers who like they're the people who can understand them more than anything else. And like these vets, like they never missed a session going to these groups. So like that's another thing. There's a book that's called The Body Keeps a Score. And basically what it means is that the trauma is held within the body. And so there's like relaxation exercises that you can do to help relax your fight or flight response whenever you get a trigger. So that way you don't get so agitated. It's called trauma focused CBT, cognitive behavioral therapy, which is essentially like trying to fix your thoughts, correcting your thoughts, so that way your feelings and your actions have better, they serve you more. Kind of going to what we were talking about, our own words, right? So there's all these different avenues, all these different ways to tackle it, and so it depends on each individual person and how they want to pursue their journey.
Mm-hmm. I laugh about The Body Keeps the Score because that book comes up so much here. That book is
Yeah, I'm
profound
sure.
in so
Yeah.
many ways. Do you think this is why it's important for people to have therapy? Because it's hard to, when you're already dealing with trauma, then it's hard to also navigate how to treat that trauma.
Yeah. What I tell people is that therapy is like, it's like having a personal trainer.
Mm.
You can get fit on your own, and many people do it. If you're 10 pounds overweight, you probably don't need a personal trainer to lose weight. If you're 100 pounds overweight, then maybe it would be helpful because your habits are clearly out of whack. You probably have some really messed up eating habits. You probably need a lot more work to be done. So same thing with therapy, right? Like, the more severe that your trauma is, the more you likely need course correction.
Mm.
And it's hard to course correct on your own when you're so much deeper in the hole
Mm.
than if you're like about to climb out. So I think
Yeah.
it can really be helpful to help guide someone's recovery.
Yeah. I'm super pro therapy here. I believe that therapy is huge, and I agree with you about the personal trainer. And even, having done entrepreneurship, it's like, well, now having a coach or a business, like a mentor, or having someone that can show me, you can just do it so much faster. So it just depends on how
Sure.
serious are you about healing. And I think sometimes people don't know. They truly do not know how beautiful things can be on the other side of healing
Mm-hmm.
from these types of things. Even, you know, not to let society tell you that your trauma is not enough. Like, I've had people sit here in front of me and tell me, like, my trauma, it's not really trauma. I'm like, that's trauma, but in our minds, we tell ourselves it's not trauma because it's not any extreme type of trauma. But I think when we as human beings can start looking at trauma as what it is. It's like something that has deeply impacted us on a very deep scale that's then affecting the way that we are doing life.
Mm-hmm.
I mean, until we can start to recognize that, we're going to continue to have unhealed people walking around, just going through the motions and just getting stuff done. And I just truly believe that healing is key to a really beautiful world that we could live in. But,
Mm-hmm.
how do you, again, back to what you said, how do you lead a horse to water? You can't make it drink.
Yeah.
All we can do is raise awareness. But with that being said, I know we're coming close to the top of the hour here. Give me, first of all, tell my guests where they can find you if they were looking to connect with you.
Yeah, absolutely. So the best place to connect with me is on my website. It's called www.agamdhawanmd.com, HEAMDHAWANMD.com. And my whole brand is called Level Up Psychiatry. And the reason for that is because, just like we have stats in any kind of video game, right? You have your attack stat, you have your defense stat, you have special attack, these kind of things. Everything you do in real life are different stats. For example, you have social skills, you have charisma, you have mental stability, you have emotional stability, you might have your diet, your exercise, whatever it might be. Like, these are all stats. And just like in the spokes of the wheel, we can level up all these stats to truly get to that happy, desired life that we want to live. And so that's the philosophy that I want to leave you with, is that, you have control over all these areas of your life. What's done is done. And now it's up to you to decide, okay, where do I want to take things from here? Like, what is my point B, and where do I want to go from here? And what skills do I need to level up to get there?
Mm. And that was my next question. What is your final takeaway? But do you have any? I mean, that was good. You definitely dropped the mic there. But do you have any other final thoughts or anything else that you'd like to say before we close up?
Yeah, absolutely. So just like I had said before, remember that what happened is not your fault, but it is your responsibility now. And until, right, you decide that, okay, I don't want to play a victim anymore, because it feels good to be a victim. Like, you feel justified. Those emotions feel good. People give you sympathy. They identify with you. No one's going to make fun of you for that, right? You get all this attention. But you can't really do the healing until you say, okay, what's done is done, right? It shouldn't have happened, but it did. Now, how do I move forward from here?
Mm. That's so good. That's so good, because I do think a lot of people fall into that victim mentality, and it's so easy to do that. We've all been there.
Right.
I mean, I've definitely played the victim, but you're right. You can't grow. You cannot grow playing the victim. It's you get
Right.
stuck in this perpetual cycle of, I don't know, toxicity and frustration with life, and you can never be happy. So that's awesome. But thank you so much for you articulate things so well, and you put it in very common terminology where anybody can understand it, using how it aligns with these different visuals. And so you're doing amazing work, and I'm so grateful to have had you today come on and share with my audience. And I've definitely learned some things. So learned. I said learned. Definitely learned. Learn. That's
Yeah.
my Southern accent coming out.
Yeah. No, thank you for having me.
Yeah, it's so nice to have you. Thank you for listening to Through the Trauma podcast. If you have found value in this episode or believe in the mission behind what we are doing, please subscribe so that you never miss any future episodes. Also, be sure to check out our transformation project at transformationthroughtraumaproject.com, where we help inspirational stories get heard on a larger scale through multiple platforms. If you know someone who can benefit from this episode, please share it with them. Until next time.